Forest Park wants to be a center of excellence for women's health. And so I thought Forest Park would be an excellent entity to team up with. As of last week, we were the first hospital, and I was the first physician to do the Acessa procedure here in the state of Texas. The Acessa procedure is a great way to treat uterine fibroids, especially those fibroids that are inside the wall of the uterus. For the longest time, we really haven't had many ways of treating those uterine fibroids. The problem is you can't see those uterine fibroids under a telescope or a laparoscope. With the Acessa procedure, we're able to use a new innovative laparoscopic sonogram device that allows me to actually see the uterine fibroids on a sonogram machine at the same time I'm looking at the uterus through a laparoscopy.
Prior to the surgery, I was feeling tired. Fibroids make you have excessive bleeding. I had heavy periods anyway, but the fibroids made my bleeding heavy. And so by me having heavy bleeding, it made me anemic. And so that made me tired. I mean, I could go to work, come home, and I just go to sleep because I was too tired to do anything else. I couldn't continue to live like this. I was doing different things to try to relieve the pressure, but it was a temporary fix.
When she went to see her gynecologist told her that her only option was to do a hysterectomy. She didn't want to do a hysterectomy. When I presented the Acessa procedure to her, she was just very, very excited that she could return back to work in a few days to a week, that she didn't have to undergo all the risk of a hysterectomy, she could keep her uterus, and that there might be some other way of treating her symptoms that she presented to me with.
Prior to the surgery, I had been on my menstrual for 2 weeks, and I was weak and I was tired. But since then, I feel like I have more energy. I feel more confident. You don't have to worry about my period gonna start without me knowing. And so it really changed my life. I'm very hopeful.
One of the most exciting things for me about the Acessa procedure is I think that it's going to replace hysterectomies for the treatments of these uterine fibroids that are hard to get in any other type of surgery. I think it's going to become the standard of care within the next few years as more and more physicians learn how to use it.